This is Jessica Zen. This is my 360 of the room. Do hand hygiene, stethoscope. Knock knock. Hi there, I'm Jessica. I'm a student nurse. The purpose of today's visit is I'm going to doing a head to toe assessment. Do you have your consent to do so?
Yes.
Just check your ID badge. What's your full name?
Ronald Lamb,
And your date of birth?
May 6th, 1988.
Alright, that's perfect. Okay, for your privacy, I'm going to close the curtains and drape you appropriately as we do this assessment. Okay, so my client he appears stated age, body structure symmetrical, skin color is even and appropriate to ethnicity. His body posture is upright. His body build is normal. Okay, and then his skin color is even throughout, symmetrical, and his facial expression is appropriate. He's dressed nicely. He's well maintained. He has good eye contact, and he's dressed appropriate for this assessment. Okay, now I'm going to check your gait. All right, can you please take a few steps front and then back to your spot? All right, perfect. So as his gait is steady, coordinated, and balanced. All right, and while he was doing that, I did not see any signs of respiratory distress. All right, next I'm gonna check your neurological. All right, so what's your full name?
Ronald Lamb.
What's the date today?
November 28th, 2025.
And where are you right now?
At home.
Okay, so my client is alert and oriented to person, place, and time. Okay, I'm gonna check the facial nerve, which is the cranial nerve 7. All right, can you smile for me? Can you frown? Can you show teeth? Puff out your cheeks, and then raise your eyebrow, and then close your eyes tightly. I'm gonna try to open it. All right, so my client's cranial nerve 7 is intact. Okay, now I'm gonna test his oculomotor nerve, which is cranial nerve 3. All right, just can you look straight there for me, please? Okay, I'm gonna shine the light on each eye, and right now it's dilated. When I shine the light, it should constrict on each eye. Okay, that constricts. Perfect. So that was direct reflex. Now I'm gonna check the consensual reflex, where I shine the light on one eye and the other eye should constrict as well. Okay. Yep. The other eye should constrict. Yep. Okay. So that's good. Now I'm gonna check for accommodation. Stare at my pen light. Follow the light or the pen. Okay. My client followed the pen. Good, so his accommodation's good. So his pupil size was about 3 millimeters in size. They're equal, round, and symmetrical, and they're reactive to light and accommodation. Okay, so his cranial nerve 3 is intact. Now I'm going to be testing cranial nerve 8, the acoustic. We're going to be doing the whisper test. All right. So for the whisper test, I'm going to say 3 words and another 3 words on each ear, and you're going to repeat those 3 words back to me. I think cover one ear. Okay, repeat after me.
Article, journal, coffee.
Okay, perfect. Cover your other ear now.
Monday, Thursday, Friday.
Okay, perfect. So his cranial nerve 8 is be inspecting his nose now. His nose is midline, there's no cresting or no discharge. Okay. Now I'm going to be testing his cranial nerve 9, glossopharyngeal nerve, and his cranial 10, down vagus nerve. So for 9, I'm going to check his gag reflex, and open your mouth wide, check for gag reflex. Okay, that's good. And now I'm going to check the vagus nerve. So you're going to stick out your tongue, say ah. Okay, so his uvula and soft palate rises simultaneously, so his cranial nerve 9 and 10 are intact. Next, I'm going to be inspecting the arms. Upon inspection, the skin is symmetrical throughout, they're symmetrical, and the hair distribution is symmetrical throughout as well, both sides, and there's no scars, no lesions. Palpate. Temperature is warm throughout. Check the edema. No signs of edema. Now I'm going to check for skin trigger. Alright, the skin pops back in under 2 seconds, so his skin trigger is good. And I didn't feel any masses. Okay, and we check for cap refill on the fingers. 2, 3. Skin color pops back under 2 seconds, so his cap refill is good. I'm going to check his radial pulses. His radial pulse is 60 beats per minute. +2 strength. Rhythm is regular, equal bilaterally. And check the brachial pulses. Brachial pulse is 60 beats per minute, +2 strength, regular rhythm, equal bilaterally. Okay, now we're gonna do some range of motion exercises. Follow me as I guide you through these, okay? So we're gonna do abduction, adduction, and then external rotation, internal rotation, okay, supination, pronation, flexion, extension, flexion, extension, and then ulnar deviation, and radial deviation. Okay, did you feel any pain?
Nope.
Okay, squeeze my fingers tightly. Okay, strength is equal bilaterally, and clients, he has full range of motion with no crepitations or pain. Alright, so next, I'm going to be inspecting your legs. And if you see your legs, okay, upon inspection, there's no scars, no lesions. His hair is evenly distributed throughout both sides. Skin color is also even on both sides. And palpate. Warm, his temperature is warm. This moisture is dry. Check for edema. No edema or skin trigger. Okay, no skin trigger is normal as his skin popped back under 2 seconds. Okay, I didn't feel any masses or tenderness either. Now I'm going to check for his toe cap refill. 3, skin color comes back within 2 seconds, so his cap refill is normal. And I'm going to check his dorsalis pedis pulse. +2 strength equal bilaterally. Now the posterior tibialis pulses. Okay, +2 strength equal bilaterally. Okay, I'm gonna do some hand hygiene. Okay, now we're gonna do some lower leg and lower back exercises. Okay, stand up. Okay, so we're going to do extension, flexion, okay, side bend, rotation, rotation, flexion on the knee, knee extension, flexion on the knee, extension on the knee. Okay, and then just lie down on the couch. Okay, we're going to do plantar flexion. Your toe should be towards me. Yep. And then dorsiflexion, which is toes towards you. Okay, did you have any pain while you're doing that?
Nope.
Okay, so my client has full range of motion on the lower body, and there's no crepitations or pain. I do some hand touching. Okay, now you can stand up again and sit in the chair. All right, now I'm going to be inspecting the lungs and thorax. Just reveal your chest for me, please. All right, okay. So upon inspection, and his anterior thorax is his chest rises symmetrically as upon respiration, and there's some scarring. There's no lesions. Skin color is even throughout. Okay, now I'm gonna be feeling, palpating. Okay, there's no moisture, no masses, no tenderness. Now I'm going to be checking the chest symmetry. Breathe in and out, please. His chest symmetry is equal bilaterally as my thumbs also move apart bilaterally equally. Okay, next, I'm going to be auscultating the lung fields. Okay, please breathe in through your nose and out through your mouth deeply as I auscultate your lungs. Okay, breathe in. This is vesicular sounds. Hearing vesicular sounds. Okay, so his breath sounds are 16 breaths per minute and regular rhythm, no invention sounds heard. And his breathing was unlabored. Okay, now I'm going to be auscultating the heart sounds. Okay, the sternal notch. Okay, go to the second intercostal space. In the right mid-sternal border, we have the aortic valve. This is where you hear S2 sounds the best. And here we have the left mid-sternal border and the second intercostal space, the pulmonic valve. Also where you'll hear S2 sounds the best. Down here is a third intercostal space in the left mid-sternal border, and that's the Erb's point. Down here in the fourth intercostal space at the left mid-sternal border is the tricuspid valve, and this is where you hear that S1 sounds the best. And down here, the fifth intercostal space in the left mid-clavicular border is where you hear the mitral valve, and this is where you hear also S1 sounds the best. Now I'm gonna check the apical pulse. Okay, his apical pulse is 60 beats per minute and regular rhythm. Next, I'm going to check for extra heart sounds with the valve of my stethoscope. Okay, there were no extra heart sounds heard. Okay, next I'm gonna be expecting the abdomen. Can you stand up for me, please? Alright, let me see. I'm gonna drape your abdomen. Okay, so and see his abdomen is shape is symmetrical. His contour is even and round. And his umbilicus is midline, no striae, no pulsations, and his skin color is also even. Okay, now can you please lie down for me? Lift up your shirt to see your abdomen. Okay, now I'm gonna be auscultating your bowel sounds. We're gonna listen to bowel sounds in all 4 quadrants, starting with the right lower quadrant, and then going clockwise. Okay, so I heard normal bowel sounds. I heard 5 to 30 bowel sounds in a minute in all 4 quadrants. The characteristics of those sounds were soft gurgling sounds and intermittent clicks. Now, next I'm going to be palpating the abdomen. Let me know if you feel any pain or discomfort. Okay. I didn't feel any superficial masses or tenderness. Next I'm going to be palpating light palpating the bladder. Okay. Didn't feel any bladder distension. Okay, since it was non-palpable. Okay, and that's the end of my assessment.